What if I told you that men over 50 can wake up stronger by activating 3 simple points in their daily routine? And one of them is a single coin-sized spot on the body you can work in 60 seconds. I'm Dr. Julia Morgan, a board-certified urologist with more than 15 years caring for men's pelvic health, and I've seen how mechanics, tension, and circulation are often the real problem, not just age or hormones. In this video, I'll show you a safe, practical 1-minute habit for the perineum, plus 2 small boosters, movement and breathing, that together help restore circulation, reduce pelvic congestion, and improve bladder and sexual function for many men. This is anatomy and training, not shame or quick-fix promises. Too many men assume decline is inevitable. They try pills and pumps as the first line of defense, and sometimes those products help in the short term, but they rarely address the underlying mechanics. Think of your pelvic circulation and nerves like a garden hose. If the hose is kinked or compressed, water won't flow even if the faucet is wide open. Pelvic floor tension, scar tissue, and congestion can squeeze vessels and nerves the same way. Loosen the tension, improve the flow, and the system has a chance to work more effectively, often with meaningful changes in sleep, bladder control, sensitivity, and overall energy. Common symptoms I see that point toward this mechanical issue: needing to get up multiple times at night, waking without the same morning firmness or sensation you used to have, sudden urges during the day, or a nagging pelvic discomfort that never quite goes away. These are not inevitable punishments of getting older. Often they are signs of reduced blood flow and tension in the pelvic floor. The good news is you can start to change those mechanics with simple daily actions. Here's the solution I want you to try. 3 points to activate every day. Point 1 is a 1-minute external massage to the perineum, the small area between the scrotum and the anus. You may have heard a different term in some transcripts or conversations. Perineum. That's just a lay term. The correct clinical name is perineum. Point 2 is a short walk, ideally after a meal, to improve circulation and metabolic handling. Point 3 is a brief breathing routine, to calm the nervous system and prime the pelvic blood flow. Together, these 3 actions retrain the body's mechanics, rather than masking symptoms. If this sounds useful, take a moment now to like the video and drop a quick comment saying "ready" or tell me where you're watching from. It helps this message reach other men who feel stuck. Now, stay with me. I'll walk you precisely through how to do the perineum massage, what to watch for, what oils, if any, you can use, and how to combine it with the movement and breathing so you get the best chance of progress in 3 weeks. How to do the perineum massage. 60 seconds, external, safe, non-invasive.
Position. You can do this sitting at the edge of a chair with feet flat on the floor, or lying on your back with knees bent and feet on the bed. Whichever position feels private and relaxed is fine. The goal is to expose the area comfortably, without strain. Locate the spot. The perineum is the area between the base of the scrotum and the anus. It's about the size of a coin. Lightly press to find a slightly tender or sensitive spot in that region. That's often a good cue for where tension or congestion is present. Use the right fingers and pressure. Use your index and middle fingers together. Apply pressure comparable to pressing a ripe tomato, firm enough that you feel compression, but not enough that it hurts or causes sharp pain. If the pressure is making you wince, lighten up. The massage patterns. Choose one. Option A, slow circular motion. Gently make small clockwise circles for 30 seconds, then reverse to counterclockwise circles for 30 seconds. Option B, press and release. Press gently for a 5-second count, then release for 2 seconds. Repeat this press-release cycle for a total of 60 seconds. Either pattern is acceptable. The key is slow, deliberate movement and focusing on relaxation, not stimulation. This is medical self-care, not a sexual activity. Do it private in a calm setting where you won't be interrupted. 5. Timing and frequency. Do this once per day for 60 seconds. You can choose morning or evening. Many men prefer after a shower or right before bed. The most important factor is consistency. 1 minute every day. 6. Optional topical comfort. If the area feels dry or your skin would be more comfortable with a lubricant, use a natural oil such as castor oil, fractionated coconut oil, or black seed oil. Always warm a small amount between your palms before applying. Put a drop on the area and use that as your surface. Important caveats. Perform a patch test on the inner forearm first to check for allergy. If you're taking blood thinners or have fragile skin, check with your provider before using oils. Stop use if you notice rash, increased irritation, or any bleeding. Safety points I must emphasize now. Never perform internal manipulation. This routine is strictly external.
Do not do this if you have an active infection, open wounds, skin lesions in the area, or recent pelvic surgery without clearance from your surgeon or urologist. If you feel sharp pain, bleeding, or any alarming symptoms, stop immediately and seek medical attention. If you're unsure whether it's safe to try this technique, for example, you're on anticoagulant medication or your doctor told you about a specific pelvic condition, consult your provider first. Why this small habit works, the physiology in plain language. When muscles are chronically tight, they act like a tourniquet. Pelvic floor tension compresses small arteries, veins, and nerves.
That compression reduces blood flow, creates congestion, and makes nerves less responsive. Tissue that is underperfused feels colder, less sensitive, and less capable of normal function. Gentle external massage can reduce muscle guarding, move small amounts of congested fluid, and signal the nervous system to relax. That relaxation improves local blood flow and nerve responsiveness. Increased flow brings oxygen and nutrients and supports normal function. On a biochemical level, increased blood flow can promote the production of nitric oxide in endothelial tissue. Nitric oxide is a molecule that helps blood vessels dilate and improve circulation. While a 1-minute massage won't single-handedly overhaul vascular disease, it can support local vasodilation and nerve health in a way that complements other healthy habits. That's why we pair this with movement and breathing. They amplify the circulatory and nervous system benefits. Why retraining beats masking? Pills and devices often change physiology temporarily, but they don't always address the mechanical constraints. Medications can improve blood flow for a time, but if pelvic floor muscles remain tight and blood vessels are compressed by tension or scarring, the underlying issue persists. A daily habit that reduces tension and encourages normal mechanics can create more durable change because you're training the tissue and the nervous system to behave differently over time. 2 simple boosters to accelerate and sustain change. Booster 1. Movement. A short post-meal walk. 10 minutes is often enough. Aim for a brisk stroll after a main meal. You don't need to run, just move steadily. This helps circulation, supports glucose handling, and reduces pelvic congestion by improving venous return from the lower body. If you can manage a 10 to 20-minute walk after dinner, that's even better for nighttime symptoms. Think of the walk as a gentle pump. It helps move blood through the legs and pelvis, reduces pooling, and makes the 1-minute massage more effective. Booster 2. Breathing. 5 slow, controlled breaths. After your massage, do a short breathing routine to shift the nervous system toward relaxation and to assist venous return. Try this pattern. Inhale for a count of 4, hold gently for 2, exhale slowly for a count of 6. Repeat 5 times. This lengthens exhalation, activates the parasympathetic system, and lowers pelvic floor tension. Deep diaphragmatic breathing also creates subtle pressure changes in the abdomen that help move blood back toward the heart, supporting circulation in the pelvis. Putting it together, a daily micro-routine. 1. Wash and get comfortable. 2. Do the 60-second perineum massage. 3. Follow immediately with the 5-breath breathing routine. 4. Take a 10-minute walk after a meal, ideally later in the day if your schedule allows. If you do these elements every day for 3 weeks, you'll be retraining the system. Gentle pressure on the perineum, repeated diaphragmatic breathing, and regular movement. Consistency is the secret. Some men notice changes within days, easier sleep, fewer trips to the bathroom at night, or a small increase in sensation. For others, it takes 2 to 4 weeks to see sustained improvements. Individual results vary, and outcomes depend on overall vascular health, medication use, and other medical conditions. Real men, real examples. Robert, 64, came to my clinic describing 3 or 4 nightly trips to the bathroom and a sense of low energy in the mornings. He started the 1-minute routine, walked after dinner for 10 minutes, and did the breathing each night. Within 2 weeks, Robert reported fewer interruptions during sleep and waking with higher energy. He called it retraining his body rather than relying on a pill alone. James, 70, was skeptical at first. He had been on medication for bladder urgency and felt that pills were his only option. He added the perineum routine and the short evening walks and noticed a reduction in sudden daytime urgence. He didn't stop his medication without medical advice, but over time he and his doctor adjusted his plan because the mechanical symptoms improved. Daniel, 65, had chronic pelvic discomfort and lower confidence. He said the routine didn't feel strange after a few days. It felt like a practical maintenance task. Within a month, he reported less pelvic pressure and more comfort during daily activities. These stories are illustrative. Many men experience meaningful change. Some feel it quickly, others need more time.
None of these examples promises a universal outcome. They show what's possible when you focus on mechanics and consistency. What to expect and how to track progress. Keep it simple. Track 3 things for 3 weeks. Number of nightly bathroom trips, subjective sleep quality, poor, fair, good, and how your pelvic area feels, pressure, soreness, sensitivity. Use your phone or a small notebook. If you notice improvement in any of those areas, that's progress. If you feel no change after 3 weeks, that's still useful information. Discuss it with your healthcare provider to look for other possible causes or adjunct therapies. Possible sensations during and after the massage: warmth, mild tingling, or a sense of release in the pelvic floor. Mild soreness can occur if you apply too much pressure. Lighten your touch next time. If you experience sharp pain, bleeding, new swelling, or any alarming symptom, stop and contact your clinician. Practical tips and common questions. Privacy. Perform the routine in private. This is medical self-care. Do it in your bathroom or bedroom where you feel at ease. Frequency. Once per day, 60 seconds. More is not necessarily better. Do not overwork the tissues. Oils. If you choose to use oil, use a small amount.
Warm it between the palms and apply gently. Do a patch test first and stop if you notice skin reaction. If you have an allergy history, check with your clinician. Medications and blood thinners. If you are on anticoagulants or have bleeding disorders, consult your prescribing provider before starting any massage in the pelvic region. Recent surgery or active infection. Do not perform this massage without clearance. Healing tissue is vulnerable. Wait until your physician approves. If you have severe cardiovascular disease or significant vascular disease, check with your specialist before beginning new routines that change circulation patterns. Why consistency matters more than intensity. This is not a one-time miracle. Training tissues and the nervous system takes repetition. 60 seconds a day is an achievable commitment for most men, and that small daily investment often produces more durable changes than sporadic, intense interventions. Think of it like dental flossing, short, consistent habit that prevents larger problems over time. A 3-week challenge I recommend to my patients. Commit to 21 consecutive days of the routine, 1 minute of perineum massage, 5 breaths, and a 10-minute walk after a meal. Record your nightly bathroom trips, sleep quality, and pelvic sensations. After 3 weeks, reassess. Many men choose to continue because the routine is short, private, and easy to integrate into daily life. A few final cautions and a clear medical disclaimer. This video is educational. It is not a substitute for a professional medical evaluation. If you have severe or worsening symptoms, unexplained bleeding, acute pain, fever, or recent surgery in the pelvic area, consult your provider immediately. If you are on blood thinners, have a bleeding disorder, or have specific concerns about skin integrity, check with the clinician who manages your medication before attempting pelvic massage. This technique is strictly external. Do not insert anything into the rectum or urethra, and do not attempt any internal manipulation. We cannot promise universal cure or complete reversal of every condition. Many factors affect outcomes. Vascular health, nerve integrity, prior surgeries, and systemic disease all play roles. What I can say from experience is this. Treating the pelvis as a mechanical system you can train often yields improvements that pills alone do not provide. This approach is about reclaiming capability with practical, evidence-informed habits. You're not broken. You're working with anatomy and physiology, and your body can respond when you give it consistent, targeted signals. If you're a man over 50 and you want to wake up stronger, commit to activating these 3 points for the next 3 weeks. The 1-minute perineum massage, the short post-meal walk, and the 5-breath breathing routine. Track your nights, your sleep, and what changes for you.
If you found this helpful, subscribe for more science-backed tips on practical men's health, and share this video with someone who needs a different approach than pills alone. In the comments, tell me what you'll start tonight. Type "I'm in," or tell us which of the 3 points you'll do first. I read those comments and I respond, because these small habits matter. Take care, and remember, small, consistent changes often produce the biggest results. I'm Dr. Julia Morgan, here to help you retrain your body with safe, practical steps.